All right, if you're prepping for your TCM boards, you're in the right place. This is your high-impact study guide, and we're going to cut right through the noise to master 5 essential formulas that you absolutely positively have to know. Let's get these locked in.
So first things first, what does it actually mean to release the exterior? I want you to think of your body's surface, your skin and muscles, like a window in a room. When a pathogen, like wind or cold, sneaks in, the room gets all stuffy, and that window gets jammed shut. Releasing the exterior is the strategy of using specific herbs to pry that stuck window open, vent out all that bad air, the pathogen, and get the fresh air or the body's qi flowing normally again. It's really that simple. Unblock the surface and let the bad stuff out.
Here's our game plan. We've just covered what releasing the exterior is. Next, we'll hit the big wind-cold classic, Gui Zhi Tang. Then, we'll have a showdown between 2 wind-heat formulas they love to test you on. After that, we'll tackle a couple of more complex cases, and we'll wrap it all up with a final cheat sheet. Let's do this.
Okay, let's kick things off with a true cornerstone of the Materia Medica, the go-to formula for a very specific type of wind-cold invasion, Gui Zhi Tang. If you only remember one formula for this pattern, this is the one.
So what's the whole story with Gui Zhi Tang? Well, it's for something called a wind attack, where the body's defenses are, well, they're just not in sync. Your protective qi, that's your frontline defense, and your nutritive qi, the stuff that nourishes you from deeper within, are fighting with each other instead of the pathogen. And this creates this really weird situation where the person is sweating, but it's not doing any good at all.
And here are the clues you'll see. You've got the standard fever, chills, and headache, sure, but the absolute #1 dead giveaway for Gui Zhi Tang on your exam is right there at the top. Sweating that brings zero relief. The body is trying so hard to push the pathogen out, but because its own defenses are disharmonized, it just can't. The sweat is totally useless.
And this is where the genius of the formula comes in. The chief herb, Gui Zhi, or cinnamon twig, does way more than just kick out the wind cold. Its main job is to be a harmonizer. It basically gets the protective and nutritive qi to shake hands and get back on the same team. It regulates the body's own defense system so the sweating finally becomes effective, and the fever and chills can resolve.
Okay, let's switch gears. Pay close attention here, because this is one of the most common comparison questions you'll see on the boards. We've got 2 formulas for wind-heat. They look really similar on the surface, but nailing the key differences is going to score you some easy points.
This slide is everything. For your boards, just burn this into your brain. Sangju Yin is for the milder, early stage of a wind heat attack. The big complaint is going to be a cough, maybe some red, sore eyes. It's all about the lungs. Yin Qiao San, on the other hand, is for when things are more severe. You've got more heat, more toxicity, and the can't-miss-it #1 symptom is a severe sore throat. So remember, cough, think Sangju Yin. Severe sore throat, think Yin Qiao San. It's that simple.
And the chief herb tells you why. Sangye, or mulberry leaf, is really light and dispersing. It's perfect for gently venting a pathogen that's still pretty superficial and hanging out in the lung channel, which is exactly why you see that cough.
Now, compare that to Jin Yan Hua, or honeysuckle flower, the chief of Yin Qiao San. This herb is a total powerhouse. It doesn't just disperse when heat, it clears heat and resolves fire toxicity. That toxicity part is the key. It's why it's so amazing for that really nasty burning sore throat. It's a much stronger herb for a much more intense condition.
Okay, let's get into a more complex scenario. What happens when a pathogen isn't just on the exterior anymore, but it hasn't fully moved into the interior either? It's kind of stuck in the middle. That's exactly where Gui Zhi Tang shines.
The beauty of this formula is that it's designed for a condition that's in transition. You've got an exterior condition, probably an old wind cold that wasn't resolved, and it's starting to cook and generate heat on the inside. So you get this confusing mix of symptoms. You still have chills and body aches from the exterior, but now you're also seeing a rising fever and maybe some irritability from that new interior heat. So how does it deal with this mess? With a brilliant 2-pronged attack led by this amazing power duo. First, you've got Gui Zhi, which is fantastic for releasing the exterior muscle layer that's going to take care of the stiff neck and upper back pain. At the very same time, you have Chai Hu, which is famous for venting pathogens from that half-in, half-out Shaoyang layer. It's literally fighting the battle on 2 fronts at once.
All right, our last individual formula. This one is for a super common but really tricky situation that you have to be ready for. What do you do when an external pathogen attacks a patient who is already weak and deficient to begin with?
This is the whole philosophy behind Renshin Baidu-san.
You can't just throw a bunch of strong, attacking herbs at a weak person. You might actually make them worse. This formula is so smart because it does two jobs at once. It expels the nasty wind, cold, damp pathogen while also supporting the patient's underlying energy, their righteous qi.
Now, the symptoms here look like a really bad case of exterior cold, right? High fever, severe chills to the point of shivering, and no sweat. Why no sweat? Because the body is just too weak to even mount a proper response. The key is recognizing that this severe presentation is happening in a patient who you know is already constitutionally weak.
And once again, the chief herbs tell you everything you need to know. It's a dual chief strategy. You have Cheng Ho, a powerful herb that goes after the wind, cold, damp invader, but it's paired with Ren Shen, or ginseng, which strongly tonifies the body's own energy. So Cheng Ho is fighting the bad guy, while Ren Shen is strengthening the home army, making sure the body has enough gas in the tank to win the battle without collapsing.
Whew, we have covered a lot of ground. So now let's put it all together on one simple slide. This is your ultimate takeaway. Get your phone ready because this is the cheat sheet you're going to want to screenshot for your final review.
Okay, let's lock this in one last time. For Gui Zhi Tang, it's wind cold, and the key is sweating with no relief. Got it? For wind heat, you've got two choices. Is the main symptom a cough and maybe some red eyes? That's Sang Yin. Is it a severe, burning sore throat? That's Yin Qiao, no question. For that messy in-between case where cold is turning to heat, look for the stiff neck and orbital eye pain of Gui Zhi Tang. And finally, for that severe wind-cold attack in a weak patient, you need to support and expel with Ren Shen by Dusan. This table is gold.
So, you've nailed the textbook cases, but here's the thing, real patients haven't always read the textbook. The final question I want to leave you with is this. How will you adapt? How will you modify these strategies when your patient shows up with a mix of these patterns? That's where the real art of this medicine begins. Good luck on your boards. You've got this.